Let's pray. Mighty God, who in your wisdom and goodness have appointed offices of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants who have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interest you've committed to our charge. Clerk, take us through the order of the day.
Order paper number 264 of Tuesday, 3rd December 2024 at 2:30 p.m. Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Members, I have got 2 communications to make. The first one is that I would like that immediately after the session we have a small kamkunji to discuss some matters related to the public participation that's going on. Number 2, I would wish to communicate to you officially that the Kisumu County Assembly was awarded by Mizani, where I attended personally, and the Honorable Deputy Speaker, alongside the Honorable Deputy Leader of Majority, as being among the top 3 top as the County Assembly of the year 2024. And what was being considered were a number of factors: progression, number of bills we have passed, what we were initially, what we are today. So we were competing amongst all the other assemblies. This research was done for a period of, I think, 6 months. For details, there is staff that is coming with the magazine that will be available for you to check what it went through. But I want to congratulate Kisumu County Assembly for that award, being top 3 in the whole country as a top trusted county assembly of the year 2024. We were beaten by counties of Embu and Makueni, who were number 1 and 2. And behind us was Kitui, among other counties. So be guided as appropriate. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions. Order number 5, papers.
Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statement.
Statement time. Honorable Leader of Majority.
Thank you, Honorable Speaker. Honorable Speaker, I raise pursuant to orders number 42 to C to present and lay on the table of the County Assembly a statement informing the County Assembly of the business coming before the House on the following week. Honorable Speaker, this is therefore to bring to the attention of members and the County Assembly that for the week commencing Wednesday, 4th December 2024 to Monday, 10th February 2025, the Select Committee on Assembly House Business at its last meeting approved the following tentative businesses to appear in the order papers as follows. On Wednesday, the chairperson of the Central Committee on Agriculture, Fisheries, Livestock Development and Irrigation will move a motion for the adoption of the committee report on site visitation to various agricultural facilities within the county. That is Wednesday, tomorrow at 9 a.m. Now, on Wednesday at 2:30, there are papers to be laid. The Leader of Majority will table the Kisumu County Integrated Investment Plan, Kisumu City Integrated Investment Plan. That is at 2:30. Thereafter, the Majority Leader will give a motion, a notice of motion for the adoption of the Kisumu City Integrated Investment Plan. Then commencement of business. The chairperson of the Select Committee on PICPAC will move a motion for the adoption of the committee report on the financial statements of Lumumba Sub-County Level 4 Hospital for the period ended 30th June 2023. On Thursday, that is at 2:30 p.m., statement to be given. The MCA for Awasenjiko, Honorable Maurice Ngeta, will seek a statement pursuant to orders number 42 2B regarding havoc wreaked by the ongoing floods in the county. Then commencements of business. The chairperson of the Select Committee on Implementation will move a motion for the adoption of the committee report on the implementation status of House resolutions on the report by the Committee on Lands, Physical Planning, Housing, and Urban Development on the representation of the county in the Lands Control Board. 2, the leader of majority will move a motion for the adoption of the Kisumu City Integrated Investment Plan. 3, the leader of majority will move a motion for the adjournment of county assembly sittings for long recess pursuant to Gazette Notice number 5804, order number 26.3 of the standing orders, read together with the House resolutions of Thursday 22nd February 2024 until Tuesday 11th February 2025 at 2:30 p.m. Thank you, Mr. Speaker.
Statement time. Next order.
Commencement of business, order number 8, motion, adoption of the report of Medical Services, Public Health and Sanitation Committee on the inquiry into the matter of growing mental health challenges within Kisumu County as sought by the Honorable Regina Kizito.
Honorable Emil, you have disappeared. I normally see you sit somewhere here. Now you are appearing somewhere else.
Mr. Speaker,
What could be the reason?
I was actually charging my tablet and I had to come and use the socket here.
Okay, proceed.
Yes. Thank you, Mr. Speaker. I'd like to move a motion on behalf of my chair, who is away on official duty. And I'd like to move this motion on the report on the inquiry into the matter of growing mental health challenges within Kisumu County, as sought by Honorable Regina Kizito, by the Committee on Medical Services, Public Health and Sanitation. And Honorable Speaker, order number 41(2)(b) of the standing orders grants members the authority to seek statements from a committee chairperson on matters within the mandate of their committee that are of county-wide concern. And in line with this provision, during the House sitting held on Wednesday, the 13th of November, 2024, Honorable Regina Kizito requested a statement that was subsequently referred to the Committee on Medical Services, Public Health and Sanitation for inquiry. The committee was tasked with investigating the matter and tabling a report before the House within 14 days. The statement sought to address the growing concern over mental health challenges in Kisumu County, especially the increasing cases of post-traumatic stress disorder, that is PTSD, and depression. On the same day, the committee wrote to the line department seeking information regarding the issues raised in the statement, and the department submitted its response to the committee on the 19th of November, 2024. The committee held 3 meetings, which include a field visit to the Kisumu County Referral Hospital Psychiatric Unit, and these meetings aimed to, number 1, scrutinize the information provided by the department, and also to conduct a field assessment of the psychiatric unit at KCRH to establish its capacity and effectiveness in addressing mental health challenges. The issues for determination in conducting this inquiry, as per the attendant, matters centered around the following. That is, number 1, data measurement, evaluation, and impact. The second one is service delivery and assessment. The third one is primary and community level mental health services. The fourth one is community engagement and stigma reduction. The fifth one is collaborations and external support. And the sixth one, historical context and funding. Honorable Speaker, the committee acknowledges and extends its sincere appreciation to the offices of the Speaker and the Clerk for their continued guidance and unwavering support throughout this process. The leadership has been instrumental in ensuring that the committee had the necessary resources and frameworks to fulfill its mandate. Special recognition goes to Honorable Regina Kizito for drawing the attention of the committee and the county to this matter and the urgent need to address it. Her proactive approach served as the catalyst for this inquiry, emphasizing the importance of prioritizing mental health. Our heartfelt thanks go to the Department of Medical Services, Public Health and Sanitation for their prompt and comprehensive responses to the committee's requests for information. Their cooperation and timely engagement have always been instrumental in ensuring a thorough and informed analysis. The committee further appreciates its members for their dedication and insightful contributions of the committee members during the inquiry, which was highly commendable. And additionally, the Secretariat's tireless efforts and valuable support in compiling this report are deeply appreciated. It is through the collective efforts of these individuals and institutions that we are able to present these reports before this House today. And in conclusion, Honorable Speaker and honorable members, it is no doubt that mental health has long been neglected, and especially in terms of resource allocation. Even as its challenges continue to escalate, the committee remains hopeful that the proposed recommendations, if implemented, will significantly help to address and improve the current situation. Honorable Speaker, I'll go straight to the findings, which members can also refer to page 4 up to 9 of the report. Honorable Speaker, the committee communicated to the department via a letter referenced and dated 13th of November, seeking response to the matters sought in the statement. And from the submission from the department, the committee established as follows. Prevalence of mental health conditions. The committee established that the specific vulnerable populations in Kisumu include victims of intimate partner violence and HIV-positive patients who exhibit high rates of depression and post-traumatic PTSD. And that while data collection efforts such as the use of PHQ-2, that is the Patient Health Questionnaire 2, and PCL-2 tools are in place, and community-wide prevalence data remains insufficient for broader program planning. Indicators for mental health, just a minute, sorry. On finding number 2, that is indicators for mental health assessment. And the committee found out that the key indicators include service availability, facility proximity, and care levels. Secondly, the mental health professionals per population, service utilization rates, public awareness and stigma reduction measures. And that these metrics guide program planning with a focus on prevention through school and community initiatives, policy adherence, and partnerships. The third finding is on monitoring and evaluation. The committee found out that the annual evaluation and quarterly monitoring are usually used to assess service usage, outcomes, and engagement, and that ad hoc assessments are also conducted to address emergent issues like rising suicide rates, influencing resource allocation, and program adjustments. The fourth finding is on the state of the psychiatric ward at KCRH. The committee visited the psychiatric unit at KCRH on Monday, the 25th of November, 2024, and established as follows. First, the structure currently housing the mental unit does not meet the standards of a psychiatric unit. Secondly, the unit currently has 30 patients, that is 17 male and 13 female. And thirdly, that the unit has a capacity of 10, That is 5 for female ward and 5 for male ward, but currently having 17 beds. That is 8 beds in the female ward against a population of 13 patients, and 9 in the male wards against a population of 17 patients. And this means that some patients have to share beds while others sleep on the floor. The fourth finding was that the beds are squeezed in the rooms with no space to walk on. And the fifth finding here was that the unit does not have a special unit for extremely special patients that require isolation from other patients. And the sixth finding is that the government is in the process of establishing a clinic majorly for substance abuse patients. And the seventh one is that to be able to stock a second line or modern drug for psychiatric patients, the facility needs about 4 million per financial year, which means that currently they're using first line medication for these patients, which has been used for over a very long period of time with very, very bad side effects. And Mr. Speaker, staffing situation at KCRH mental unit is as follows. There are only 6 nurses available working 24 hours. That is 5 employed by the county and 1 volunteer. And out of the 6, only 3 are qualified psychiatric nurses. The rest are practitioners. And there's just 1 consultant clinical officer. And there's only 1 volunteer psychologist and none employed by the county government. And there's only 1 casual social worker who is serving the entire KCRH. And in order to operate optimally, the unit requires at least 5 clinical officers. That is 4 social workers and 6 nurses and a psychologist. Mr. Speaker and honorable members, the challenges at the mental unit were as follows. The first one was the long stays. The facility has a special category of patients who are brought to the facility with no relatives, and the hospital has no way of tracing their families. So such patients, like there was a particular case who has been there for over 30 years, and such patients are constant bed occupants and are not able to give room for new patients. The second challenge at the unit is the inadequate funding. There is no allocation for repatriation, and the funds given to the unit cannot even allow the facility to purchase second line or modern drugs for the patients. And the facility is still using first line drugs, which has been found to have severe side effects on the patients. The third challenge is on limited space. The unit is overstretched as it is, where a room that is supposed to accommodate 5 beds is currently having 9. So there's no room for expansion, but no resources to see it through. Mr. Speaker and honorable members, we have the other finding on the plans to enable our facilities to provide mental health services. In order to meet the growing demand for mental health services within the county and to disburden KCRH, the county is planning to, number 1, strengthen mental health services at primary health care facilities to ensure that early detection and management of conditions and reduce the burden on tertiary care facilities like JOTRH and KCRH, and to improve access to services in rural areas, and also to focus more on community support and education aimed at reducing stigma. On staffing and professional gaps, the mental health workforce in Kisumu County, the mental health workforce in Kisumu County is critically understaffed with the available workforce gaps as follows. That is psychiatrists. As per the World Health Organization recommendation, there should be 1 psychiatrist per 1,000 people. With a population of over 1.2 million, Kisumu requires at least 12 psychiatrists to meet this benchmark. And that the county currently has 2 psychiatrists employed by the county and 2 supporting from Maseno University. And also that there is required about 3 to 5 additional psychiatrists to be able to manage the current situation. On our clinical psychologists, according to the World Health Organization recommendations, is for 1 clinical psychologist per 100,000 people. And that with the population of the county, it requires between 12 to 15 psychologists, but currently none are present. And that the clinical psychologists are needed, especially in primary healthcare facilities and rural settings. On counseling psychologists and social workers, that while the number of counselors is currently at 3, and social workers have also been employed, there is a deployment gap since most of these are stationed in the urban or peri-urban areas, leaving rural populations underserved. For psychiatric nurses, according to World Health Organization standards, they recommend 3 to 5. They recommend 3 to 5 psychiatric nurses per 100,000 people. And that currently the county has approximately 9 psychiatric nurses, but the requirement exceeds based on the population, and that additional psychiatric nurses are required to meet the county's mental health needs with focus on rural deployment to aid in integrating basic mental health care in PHC. On community health promoters, although community health promoters are critical for grassroots mental health support, few receive formal mental health training, and this gap hinders early detection and referrals for mental health issues. And capacity training is ongoing, and that staffing gaps in mental health services are driven by challenges such as the limited local training opportunities, brain drain, low prioritization of mental health in public health, inadequate incentives for rural deployment, underfunding and less prioritization compared to other health challenges, and lack of sufficient incentives in rural areas to attract professionals. Mental health services in PHC, and that the county's PHC facilities provide basic mental health support, including supportive management and counseling for mild to moderate conditions, referrals for complex cases, and the administration of basic psychotic medications where available. Although mental health screening is limited, tools like the PHQ2 are used in some facilities, and that PHC are, however, faced with such challenges as limited staffing, inadequate infrastructure for privacy and consultations, low prioritization of mental health, stigma, and inefficient referral systems that impact on the integration of mental health into the PHC network, and lack of essential medications and integration into routine care. And that to address these challenges, attempts have been made that include integrating mental health into routine care, increasing mental health training for PHC staff, ensuring a steady supply of psychotic medications, and improving collaboration with CHWs, and strengthening infrastructure such as creating private consultation spaces and utilizing telepsychiatry, which is also suggested. Mr. Speaker and honorable members, and the 10th finding is on planned community initiatives. And the committee found out that there are several existing and ongoing community outreach programs aimed at raising awareness and reducing stigma, which include training the CHPs on mental health conditions and how to use simple screening tools like the PHQ2 and PTSD checklist to identify cases and refer individuals for appropriate care on mental health conditions such as PTSD. This will help identify early symptoms and provide accurate information to communities. The community sensitization. CHPs will in turn organize forums to educate communities about mental health, emphasizing that conditions like PTSD are medical and treatable. And thirdly, collaborations with religious groups to offer faith-based counseling and to incorporate positive messages about mental health into their sermons to help address misconceptions and promote understanding. The 10th finding is on training programs for healthcare workers. The committee found out that there are few healthcare workers who have received mental health training through programs like World Health Organization's MHGAPIG and continuous medical education. However, limited financial resources remain a big challenge to this cause. On collaborations and partnerships, the committee found out that there are NGOs that contribute significantly through public awareness campaigns, training and support services. However, fragmented coordination and data sharing hinder optimal resource utilization. And the third is the factor that have contributed to the limited prioritization of mental health issues in the past years. And the committee found that the major factor that has over the years contributed to limited prioritization of mental health in the budget is competing health priorities such as communicable diseases like HIV, AIDS, malaria, and tuberculosis, which are more visible and have significant public health implications, often take precedence in resource allocation. And conditions like diabetes and hypertension are also increasingly prioritized, leaving limited resources for mental health. And a rising need for infrastructural development has also preceded the need to prioritize mental health. Mr. Speaker, sir, and honorable members, on the challenges, the committee established that the following are the challenges affecting the county's attempt to address mental health. The first one is insufficient funding. The mental health, the insufficient funding on mental health often receives less than 1% of the health budget, reflecting its low prioritization. And donor agencies often focus on communicable diseases or maternal and child health, neglecting mental health programs. The psychiatric unit at KCRH cited resource constraints that hinder its operations, especially on essential drugs that the patients need. And currently, the patients are given first-line drugs which have severe side effects. Secondly is the stigma and cultural misconceptions. The third challenge is limited political advocacy and weak policy implementation. The committee discovered that although mental health policies exist nationally, their implementation at the county level is weak due to insufficient resources, poor coordination, and lack of accountability mechanisms. And that limited legislative focus on mental health hinders proper budget tracking and advocacy. And the fourth challenge, Mr. Speaker, sir, is infrastructural deficiencies. The county still lacks certain infrastructures in its health facilities that are ideal for mental health services such as privacy rooms. The fifth challenge is on human resource constraints. The critical shortage of psychiatrists, psychologists, and psychiatric nurses undermine service delivery, making mental health less visible in healthcare planning. And KCRH and the county at large lack professionals across all cadres that hinder attempts to exhaustively attend to the matter. And the professionals tend to concentrate in urban areas, leaving rural regions underserved and contributing to uneven access. And the sixth challenge is the brain drain. The committee discovered that trained mental health professionals like others often leave for better paying opportunities abroad, exacerbating the staffing gap and reducing the visibility of mental health issues. Mr. Speaker, sir, and honorable members, the committee therefore recommended the following. Number one is that to address the challenge of inadequate mental health professional, the Department of Medical Services, Public Health and Sanitation, in collaboration with the County Public Service Board, should develop a recruitment strategy to prioritize hiring critical medical staff. Secondly, should consider exploring partnership with medical schools and institutions to establish an internship program with channels young professionals to the facility and the county. And thirdly, they should provide scholarships or sponsorships program for staff to specialize in critical areas, including psychiatry, with a binding agreement to serve the county after completion. And fourthly, to train CHPs to handle and offer basic mental health services, leaving only complex cases for the professionals. The second recommendation is that the Department of Medical Services, Public Health and Sanitation should strive to prioritize expansion and improvement of existing psychiatric facilities to adequately meet the growing demand for mental health services in Kisumu County, and to enhance the quality of care by providing a more conducive environment for recovery and ensuring patient dignity. The third recommendation is that to address low funding to mental health, the county should develop and implement an act addressing mental health with provisions to secure better resource allocation for psychiatric services to enable them procure modern drugs with fewer or no side effects. And it should also advocate for the inclusion of psychiatric medication in the National Hospital Insurance benefits for patients. The fourth recommendation is that the county should diversify revenue streams by incorporating revenue from other public health programs to support the psychiatric unit at KCRH, and proposing public-private partnership to supplement funding and resources for drug acquisition and operation. The fifth recommendation is that the Department of Medical Services and Public Health and Sanitation should establish clear, measurable targets for mental health services supported by robust accountability mechanisms to ensure effective implementation and monitoring. And Mr. Speaker, sir, and honorable members, the sixth recommendation is that the Department of Medical Services, Public Health and Sanitation should prioritize the integration of mental health services in primary health care by enhancing staff training, ensuring consistent access to essential medications, and adopting telepsychiatry to improve service delivery, especially in underserved areas. The seventh recommendation is that the Department of Medical Services, Public Health and Sanitation should consider partnering with schools to teach students and patients about mental health, emphasizing that PTSD and related conditions are treatable, and also establishing peer-led initiatives where students can discuss mental health issues in a safe, supportive environment. The eighth recommendation is that the Department of Medical Services, Public Health and Sanitation should consider integration of mental health in public events and to normalize discussions around PTSD and other conditions. The ninth recommendation is that the Department of Medical Services, Public Health and Sanitation should collaborate with the local leaders to establish informal grassroots support groups such as PTSD support circles for individuals affected by trauma, to share the experiences and seek peer support, and offer family education programs by involving families in understanding PTSD and mental health to enable them support affected members better. This will help reduce stigma surrounding mental health. And in conclusion, Mr. Speaker and honorable members, it is no doubt that mental health has long been a neglected area, especially in terms of resource allocation. And even as its challenges continue to escalate, the committee remains hopeful that the proposed recommendations, if implemented, will significantly help to address and improve the current situation. It is now my pleasure, on behalf of the committee, to move this motion and that this House adopts this report of the Medical Services, Public Health and Sanitation on the inquiry into the matter of growing mental health challenges within Kisumu County, as sought by Honorable Regina Kizito. And therefore, Honorable Speaker, may I call upon Honorable Seth Okumu to second.
Yes, Honorable Seth.
Thank you so much, Honorable Speaker. Honorable Speaker, I rise to second the adoption of this report from the Committee on Health. Honorable Speaker, allow me to bring to the attention of the House that it's becoming a norm that we raise statements, but when it comes to time for answering, most of the time members who raise these statements are not there.
and it has seen a trend in which a statement is raised after 3 months, somebody raises the same statements. After 2 months, another person raises the same statements, as it's happening with statements on floods. So we would have loved to have the person who raised the statement to be here to see how we as a committee addressed his concerns, but sadly she's not around. But we believe it's not because she has mental issues, because it would be interesting that you raise a statement and you don't come. Allow me to also thank members of the committee, as mentioned in that report. If you look at the statements that were raised, I think this is the only committee who has got the highest amount of statements, and also questions in these statements were amounting to 12. And Honorable Speaker, it looked like somebody was trying to do a research through the assembly, but with the commitment of the committee members, like people who have gone to Asumbi Girls, like the Honorable Nerea, the Deputy Speaker, and General Patrick Lumumba Wade, we managed to respond to the questions in consultation with the department. Honorable Speaker, mental health, most of the people believe that it's only restricted to the hospital setup. And if you talk to people in Kisumu, they restrict it further to Ward 8. But Honorable Speaker, sometimes I think even in this assembly, we have issues of mental health that need to be addressed. Especially, I've seen members who worked so hard to come to the assembly, but now being here becomes a problem for them. Campaigned, talked to the party to get nomination, and now sitting here becomes a problem. I think it's something that needs to be addressed as it is in this report. Honorable Speaker, we went to the only mental health institution that we have in Kisumu, which is at Kisumu County Referral Hospital, and I want to agree that with the limited resources that we provided for that institution, they are doing their level best to provide mental health to address issues of mental health within the county. It's worth mentioning, for those who don't know, that that clinic has an outpatient clinic and also an inpatient clinic. The outpatient clinic deals with counseling. The inpatient clinic deals with patients who have now outblown being managed by the outpatient. Honorable Speaker, I will keep mentioning that after going there, the level of hygiene we observed at Kisumu County Referral Hospital Ward 8 was so good, and it's worth mentioning. And talking to those people, they need a lot of support from this assembly to provide the best services that they can give to people with mental health issues. As mentioned in the report, we need more staff. We need more infrastructure for mental health. And Honorable Speaker, they mentioned that it's not a good practice to have a mental health hospital that is detached from a hospital setup, like setting up a different hospital somewhere just to manage people with mental health, as we are doing with Madare Mental Hospital. From the observation, that creates a lot of stigma to the people that we manage for mental health, and they are proposing that any improvement should be attached to a health facility, so that other than addressing issues of mental health, should there arise any other ailment to some of those clients, then they can also be attended to by the different professionals that they require for those different ailments. Honorable Speaker, this report should form a basis of increasing allocation for mental health in Kisumu County. Addressing issues of mental health should not wait until you are admitted into the ward. addressing issues of mental health, including psychological counseling that we can give to our staff, our children in school, our members of county assembly at their workplace, couples. We can do it in churches, but this can only happen if we have staff. And the gap that is mentioned in this report can only be bridged if we give them more resources come the next budgeting cycle. So, honorable members, as we talk about roads, as we talk about water, as we talk about agriculture, as we mention health generally, we should be specific on issues of mental health. Honorable Speaker, without much ado, allow me to sit down and repeat that I second the adoption of this report. Thank you, Honorable Speaker.
Honorable members, now that the motion adoption of the report of Medical Services, Public Health and Sanitation Committee on the inquiry into the matter of growing mental health challenges within Kisumu County, as sought by Honorable Regina Kizito, have been moved, seconded. I want to propose a question, and I propose that the motion is open for debate. As Honorable Nerea, the Deputy Speaker.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support the adoption of this report, not because I'm a member of the Health Committee and part of the team that did the report, but Mr. Speaker, considering the recommendations we've put down here, Mr. Speaker, we've outlined so many challenges that we as a committee noticed. Mr. Speaker, as has been observed that the unit has a capacity of only 10. And currently the unit holds 30, 17 being men and 13 being women. Mr. Speaker, having patients and especially psychiatric patients lying on the floor, sleeping on the floor, Mr. Speaker, cleanliness notwithstanding, is unacceptable. Mr. Speaker, we appreciate that Ward 8 at the Kisumu County Referral Hospital does not only serve Kisumu County. It is worth noting that this facility serves the entire Western region. And Mr. Speaker, it is only proper that we expand and consider, as has been recommended, partnerships that will ensure that the facility is given sufficient capacity to take care of the mental issues that we face. Mr. Speaker, it is also been noted that the facility can only administer first-class medication. Mr. Speaker, second-class medication is necessary because at times you find that there are patients who may develop resistance, and some others just have drug incompatibility, Mr. Speaker. So when they are incompatible with the first line drugs, then it is only appropriate that we have as an alternative the second line drugs, which, Mr. Speaker, the facility does not have, and they are requesting a budget of 4 million per financial year to help them take care of that, Mr. Speaker. As has been requested by my colleague, Honorable Seth, that we need to consider KDH in the next budget, considering that they are only given 1% of the budget health per financial year. Mr. Speaker, staffing is also an issue where we have only 5 nurses attending to the 30 psychiatric patients, and out of the 5, one is a volunteer, and out of the 5, only 3 are qualified psychiatric nurses. Mr. Speaker, it is proper that we consider also hiring. And this, Mr. Speaker, we also recommended in the previous reports of our sub-county hospitals, where we found a lack of accountants, and knowing that most of these facilities, Mr. Speaker, also get audited. And I think, Mr. Speaker, most of those reports came after the budget was done, that is the 2024-2025. This report is coming early, and I want to ask that even as we do the ADP, Mr. Speaker, this Honorable House, in collaboration with the line department, that is the health department, may consider giving a good amount to KDH. But considering, Mr. Speaker, that it does not only serve Kisumu County, we also want to recommend that the department also need to liaise with the other regions that depend on this facility for support. And as Honorable Seta said, Honorable Speaker, mental health does not only mean restriction in hospital. And so even at the counseling unit, that is the OPD, we may need to add a number of service providers to ensure that Kisumu County is healthy mentally for better service delivery. Otherwise, Honorable Speaker and Honorable Members, I beg to support.
Honorable okay, Honorable Uko.
Thank you. Thank you, Mr. Speaker. Mr. Speaker, I stand here to support the adoption of this report from the Committee of Health. Mr. Speaker, I'm privileged to serve in the County Assembly of Kisumu, and I'm privileged to be privy to the first reports which come from the public, and probably the investigative reports we are getting from the entities which are serving the Kisumu County. Mr. Speaker, our work here is to help the county run accordingly. And we know one of our roles is to oversight. And we are also given the opportunity to correct any mess which is presenting itself within the county. Mr. Speaker, our system is a bit biased because we really measure on treatment, but not preventive way of managing our problems. Mr. Speaker, the other time when I compare with this result, we were talking about mosquito prevalence in Kisumu. And the way we were handling the issue, we were only focusing on treatment, but not preventive. Mr. Speaker, there are primary preventive measures which will be taken before we get into secondary part of it, where now we admit patients to hospitals and such kind of things. And Mr. Speaker, we must drive away the stigma associated with mental health. Because, Mr. Speaker, if we can't train our public health officers to also train teachers in high schools where we first realized the effects of mental health. Because, Mr. Speaker, it starts from year 14 to year 22. That is now within the period of development. And it is very possible for the teachers who are handling the students to detect that problem and probably prevent it from developing to a situation where we get into the secondary part of it, where somebody goes to the hospital. If we can do a lot on preventive measures and train the right people, the right counselors to deal with these issues, Mr. Speaker, will not be having many patients in our hospitals, maybe very few extreme cases. Mr. Speaker, we know very clearly what contributes to these problems. Some of them, Mr. Speaker, are exposed to environmental challenges, which we actually starts from home. And whoever is at home who is a parent or an uncle doesn't understand how to handle that issue before getting to the hospital. That is why we are talking about the basic, Mr. Speaker. If we can own up the problem and not only leaving it to the doctors, we will succeed. Mr. Speaker, we have a lot of challenges, especially to the Kisumu County Referral Hospital. Mr. Speaker, remember, with all this stigma involved, it requires somebody who has a lot of passion in the name of a doctor and probably talented to handle these people. Because, Mr. Speaker, we take the patients to hospitals after being overwhelmed at home. And now it is like we are taking them to the jail. And you understand the few staffs involved, and these are 69 people or 60 plus people, and a few personnel. And this is why, Mr. Speaker, I was talking about we have the powers to rectify the problems we are facing with our referral hospital, that's now district hospital. We should put more money to this facility because you cannot know. No one will run away from this problem. No one no one cannot run away from being mentally affected. Maybe it is me tomorrow and I'll be going to that hospital because with Russia we don't have that kind of facility. Probably at Aga Khan we might not be having such kind of facility, but it is only a district hospital. So it is not only improved for the voters, but even to the leaders. Mr. Speaker, it is very important that we have, with us here, we have a lot of problems. Some may be caused by tough economic challenges. Mr. Speaker, madness, it is for everybody. It is not only for those who have run mad or who are taking out their clothes. But even to us here, you may find at times somebody is just talking to himself. And that is abnormal kind of behavior. That abnormal kind of behavior, that is what is called madness. So people are only thinking that those who are in the hospital there are the only people who should be tagged as mad. Madness is with us. We must do it. We must own it. We must take it head on. And we must see that we fight it because it is with us. Mr. Speaker, if we can fail for our next budgeting not to allocate money to Kisumu District Hospital, Kisumu County Referral Hospital, Mr. Speaker, we will be failing our duty. So members of the County Assembly, I urge you through the Speaker so that we look into this issue when we come back for allocation of resources to our facilities. Mr. Speaker, I support the motion. Thank you.
Mildred Ajumbo.
Thank you, Mr. Speaker. Mr. Speaker, I want to start by commending the Committee of Health Services for the research they did at the county health facility. I want to say that this is a very serious work that was done by the committee after Honorable Regina addressed the statement. I want to start by saying that we live in a society where talking about mental health invites discomfort and stigma. When you talk about mental health, many of us think that it's only the people that are in hospital. And I want to agree with Honorable Kennedy that many of us seated here or even outside have mental health challenges. And sometimes some of these challenges are brought by maybe lack of proper diet, lack of sleep, lack of positivity, and many of us who do not do exercise because of too busy may also go through the mental health challenges, not just the ones in hospitals. I want to agree with the committees on the challenges that they saw in KTRH and some of the recommendations from the committee. It is true that when the committee went to the KTRH hospital, a lot of observations were made there. And I just want to read observation on the status of the psychiatric unit. That the committee found out that the structure currently housing the mental unit does not meet the standards of a psychiatric unit. What do we mean by the standards? WHO has the standards for almost everything that we do in life. You look at the KCRH and you look at the number of nurses that are working in that unit. We only have 6 nurses available. There's a volunteer. There's only 1 psychiatrist. Actually, they don't have many psychiatrists and clinical officers. And when you look at the WHO recommendations, we are way below the recommendations of WHO. Then it means that this KTRH hospital does not even meet the standards of housing the mental health unit. So you end up that out of the 6 nurses, these 6 nurses work 24 hours. You can imagine a nurse working 24 hours. You are in a mental health unit. So what happens next? The next thing that will happen, the mental health nurse will also have mental health issues, yet she's looking, or he is looking after the mental health people in hospital. Yes, it is wanting the number of health facility workers that are in this hospital. You look at the psychiatry is lacking. You look at only 1 volunteer. Look at the challenges that there's 1 patient that has been there for 30 years. And all this that were discovered by the committee. The committee also gave some of the recommendations that I want to agree with them. That yes, in order to improve the mental health facility at KTRH, there is, because of inadequate funding, in this year's budget that is already gone, but we are looking at the financial year 2025 and 2026, that when we sit down as a county assembly, let us prioritize on the amount of allocation that goes to the mental health facility. That's the only way we will improve. Yes, without inadequate funding, there'll be a lot of issues still, because many of us seated here, I'm sorry to say that if today you were to be taken to that facility as a patient, sincerely you are going to share a bed or you're going to sleep on the floor. So that is the reality that is wanting. We need to be serious when you're doing the budget allocation, that a lot of money needs to be allocated to this facility. They also say there's limited space and there's no room for expansion. So what happens to that? There's need for the county assembly, while doing the budget, that we need to create room as we do the budget allocation. And a lot of other issues that the committee went through. I don't want to go through all the challenges because it will be like repeating what other people have said. But I want to agree with what the committee has recommended that yes, there needs to be funding so that this facility can be improved. I agree with the committee that we need to support this. We need to support this work so that their work can be made easier. Thank you, Mr. Speaker.
Honorable Alice Wajah.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support the adoption of this report by the Committee of Health. And first of all, I want to applaud the committee for the detailed and elaborate report. It is well done. And I also want to agree with one of my colleagues who have said that this report is not just a report, but it is a research paper. And I'm very sure that if other people who are in this field get hold of it, they are going to use this as a research paper. I also want to congratulate and also my special recognition goes to Honorable Kizito for drawing the attention of the committee and the county at large on this very important issue. As the reason why I'm saying that is that it touches on my area of specialty as a trained psychotherapist. Mr. Speaker, I want to bring to the attention of the House that it is true. And I also agree with all the recommendations and the findings of this committee. It is true that mental health has been neglected, a neglected area, especially in terms of resource allocation, which are not, the allocation is not enough for them to improve their infrastructure and even to buy drugs. And there is also lack of manpower in terms of mental health workers. Mr. Speaker, this one is a very, very important issue. As one of our members have said that we have mental issues everywhere around us, in our houses, in our homes, and even here in the assembly. Most of us here, even me, at one point, I always have mental issues. Because as politicians, we go under a lot of stress, out and even around wherever we are meeting with our people. It is not that when somebody is mad and taken to the psychiatric ward, that the people we can say that they are mad. It is mental health issue. All of us here, we are going through that. And all of us here, we are just 1 minute or one step away from psychiatric ward. Because that stress we are going through, it can turn into depression within a very short time, and then pop, you are taken to the psychiatric ward. And it is unfortunate that we only have one psychiatric ward, which is ill-equipped. As you can go through the report, it is indicated here in the report that the capacity, which is supposed to have 10, 5 male and 5 female, now is housing 17 beds. This ward is in a very pathetic state. There is no room. You can just imagine. There is no space. And it has been here like this for all these years. Mr. Speaker, I want to agree with the committee that mental health issues should be given quick, and the response, the recommendations should be implemented as soon as today. it is very sad that we have so many people here, outside here, who are challenged physically and emotionally, and we don't have enough psychologists and even enough clinical psychologists who can assist them. Every day when you go to social media, news, even to our daily newspapers, you hear that people are killing themselves. People are killing each other. What is that? This is a mental issue. Even the doctors, they are also challenged. They are suffering from burnout because they are few and they are handling many patients. They work throughout even without resting, simply because we don't have enough staff. Mr. Speaker, I want to agree again and again with all these recommendations. Let us give enough money. Let us allocate enough cash. If they want that it is written, it is 40 million or what? How many millions? I've not. 4 million. Me, I really totally agree with that 4 million. And if possible, they should even be added so that they can improve on their infrastructure, they can improve on their drugs, they can improve on their work, the healthcare workers. There should be trainings going on and even refresher trainings. And even the healthcare workers, the psychologists, the clinical psychologists, the psychiatrists, they should be going for, it is called supervision. They should also go through mental health assessment each and every time so that they can work on their emotions and all the burnouts they are suffering from. So, Mr. Speaker, sir, it is real that everywhere, even in our homes, we have so many people, even the elderly, our youths, they are suffering from depression, they are suffering from schizophrenia, they are suffering from stress, and even our elderly, they are the elderly in our communities, they are also suffering. Psychologists are few. They should be trained and they should be posted in our rural health facilities so that all the people in the grassroots can access their services. With those few remarks, I also want to say that I support and this report should be taken seriously and implementation should be taken as soon as possible. Thank you so much, Mr. Speaker.
I presume silence means the mover should reply. Honorable Emily.
Thank you, Mr. Speaker. From the contributions from the members, first of all, I'd like to appreciate the honorable members for supporting this motion, especially the committee members who actually put in a lot of effort to come up with this report, because as I was reading through it, I actually learned that a lot of information that is needed to help create awareness on mental health issues within the county. I'd also like to appreciate Honorable Regina Kizito. If only she was here, I think she would have been able to also make a contribution for coming up with this statement, which was a very important statement at this point. Because, Honorable Speaker, having been part of the team that visited the psychiatric ward at KCRH, there's a lot that needs to be done. And I keep on telling people that mental health illness does not discriminate. It is an illness that can actually get anybody. And when we visited the facility, actually it was, we learned that it's actually the only facility within the whole of Western region handling all the cases that come from around other counties also. And with the limited resources allocated to this department, we are actually doing a lot of injustice to the people who are serving at this department. I'd like to encourage the honorable members to take time and maybe just pay a visit to the facility. It's open to the public. You can walk in and maybe just have a discussion with them and get to learn about the issues that are pertain as per mental health illness within the county. Mr. Speaker, one of the key issues that has been emphasized by most of the members is on the drug that is used at the facility. You find that they've used the same type of drugs for over 40 years. You know, it's more like treating malaria with the quinine, which was the first malaria drug that was discovered many, many years ago. You know, all these illnesses with time, they keep on changing, and some of them actually become resistant to some of these drugs. And you can imagine having a patient who's being treated with the same line of drug that has been used for over 40 years. You can imagine the kind of effect that they're having. So it's more like they're creating more illnesses in these people that still needs to be handled. So it's more like we're going round and round in the treatment of mental health, which actually we need to now work towards moving to the second line drugs. And therefore, with this, I'd like to encourage the Committee of County Budget and Appropriation to consider allocating at least something reasonable on mental health in the next financial year. I'd also like to encourage members. Mine is just to emphasize, because most of the members who contributed did not raise any concerns that need to be replied to. So mine is just an emphasis on most of the recommendations, especially on the opportunity for training on psychiatric courses. This is an opportunity, and I'd like to encourage members to encourage the people as you have these forums. Talk to them, encourage them to encourage the young ones to go for training so that we can have more qualified personnel who can actually come in and support in offering the services. Mr. Speaker, I'd just like to mention one thing that has been raised several times. Just recently, we celebrated World Mental Health Day. And actually, it was celebrated somewhere in Seme sub-county. I'd like to have this on record because if it was my wish, I would actually encourage those who organize this day to celebrate this day at the facility, at the KCRH facility, because that is actually where the real issues are. And I think as they celebrate the day there, then they'll be able to get to know the real picture on the ground on matters service delivery on Mental Health Day. And also, as we visited the facility, most of the committee members were touched. And actually, we are suggesting that we organize one of the days and have members to take a visit to the facility and maybe just take in something little, just to encourage the patients and also to encourage the staff there. Because the work they're doing there is overwhelming. In as much as they're really trying their best, but it's really overwhelming. So I'd like to encourage members. I know very soon we'll be calling upon you to accompany us to the facility and just have a day to celebrate with them. Otherwise, Mr. Speaker, sir, I'd like to appreciate the House, and therefore I reply, thank you.
Honorable members, now that the motion adoption of the report of the Medical Services, Public Health and Sanitation Committee on the inquiry into the matter of growing mental health challenges within Kisumu County have been moved, seconded, debated. Therefore, as per our standing order, I want to put a question. And I put that as many of the opinion that the motion adoption of the report of the Medical Services, Public Health and Sanitation Committee on the inquiry into the matter of growing health challenges within Kisumu County as sought by the Honorable Regina Kizito be adopted, say aye. As many of the contrary opinions say nay. The ayes have it. And the motion, adoption of the report of Medical Services, Public Health and Sanitation Committee on the inquiry into the matter of growing mental health challenges within Kisumu County, sought by Honorable Regina Kizito, is adopted today, Tuesday, the 3rd of December, 2024 at 15:57 hours. I direct that the recommendation of the committee of the report be communicated to the relevant department for action. Next order.
Mr. Speaker and honorable members, there is no any other business in the order.
We can be upstanding. Honorable members, there being no any other business in the order paper, the House stands adjourned until Wednesday, the 4th of December, 2024 at 9 a.m.